Hello. So this is for the case of Julie. And these, will be my take and my answers to some of the questions that's being asked. So first question being, what signs and symptoms in Julie's presentation suggest that she may be experiencing a mental health crisis, and what additional information would you want to gather to support your assessment? After reading Julie's case, I can definitely say that she's like been showing several signs that she may be experiencing like some type of mental health crisis. And they found her eating grass because she believed it would help her unborn baby, which I guess pretty much suggests like the impaired judgment and unusual thinking. She was also pacing around the room. She was talking nonstop. She kept getting like easily distracted. And then like she got so stuck on like a stain on the window. And she also like just reported that she wasn't sleeping for over 24 hours. And she just seemed like really irritated throughout like the whole entire interview. And I feel like just those symptoms could just be in relation to like her having like a manic episode or something, or like going through some type of psychosis. And I think with me, I would like want to gather just more information, just about whether she's experiencing these same kind of like episodes before. I also want to know if there's just like a history of like mental illness within her family, and like if she's been diagnosed with a mental health disorder in the past, whether she is like taking any medications for it, and if she's experiencing like just like hallucinations or just delusions or just thoughts of like harming herself or just harming others. And also, I just would want to know like more information just on the alcohol use and the last time she used meth. Um, yeah. For my second one, the question was, how might Julie's history of childhood trauma and family substance use influence her current functioning, relationships, and mental health systems? Her childhood was already filled with a lot of trauma. Like, she experienced like neglect from her mother, some physical abuse from her mother's boyfriend, and she just was abandoned by both of her parents, and she grew up around substance abuse. And I feel like when you grow up around it, it can most definitely increase the risk of developing both both those the mental health and the substance use disorders later on in life. And I feel like those experiences may have made it difficult for Julie to like trust other people and like how to like regulate her emotions and cope with stress and things like that. And I also feel like her childhood trauma might play a part too. Um, I feel like it might play a part to like just her anxiety and her depression and also her PTSD, because substance was really like normalized in her family, and she might be more likely to use alcohol and drugs as like a coping mechanism of some sort. Um, for question three, what risk and protective factors are present in Julie's case, particularly considering her pregnancy, substance use history, and social support system? Some risk factors definitely being that she is 4 months pregnant and she's still trying to drink alcohol. Just her history of using meth, her not really getting enough sleep. I would say like the manic episodes, also like her childhood abuse and just neglect, and just her family's history of like substance use, her not having a job, and also just her recent run-in with the police. Um, some protective factors, I would say some protective factors would be like she pretty much reported that she wasn't using meth anymore after finding out that she was pregnant. She also does have like a couple of supportive relationships with her boyfriend John, her friend Jessie, excuse me. She does have a good relationship with the younger half siblings. And she's also extremely like connected through like the medical care, through like the emergency department. So I would say although she does have some protective factors, her current systems like really outweigh that. And yeah. Um, Question 4, it says, based on the information provided, do you believe a 72-hour psychiatric hold is warranted? What evidence from the case supports your decision, and what ethical considerations should the social worker keep in mind? I would say, just based off of the information that was provided, do believe that a 72-hour psychiatric hold is appropriate, because I feel like with her behavior, she might not be able to like safely care for herself, or her unborn child. They found her eating grass because of a false belief about, pregnancy. And yeah, and she went over 24 hours without getting any rest. She just seemed really agitated, and she couldn't concentrate. And she just continues to drink while being pregnant. That's really not good. Um, and I would say that her behavior, it can definitely like raise some concerns about like her ability to make more safer decisions. Um, and I can say that a psychiatric hold would probably allow healthcare providers to complete a full like evaluation and like really just stabilize her symptoms and just determine the most appropriate treatment plan for her. Um, at the same time, the social worker has to balance protecting Julie and her unborn child with respecting her rights, at least. And I would say the least restrictive intervention should always be considered. Um, and Julie, she should be treated with like some type of dignity and respect because at the end of the day, she is a woman. Um, and yeah, and five, um, the last question: if you were the social worker conducting this assessment, what would your immediate priorities for intervention and discharge planning, and what community resources or referrals would you consider appropriate? So I would say my first priority would be ensuring that Julie's immediate safety, like just making sure that she's safe. Also, just completing like a suicide or like homicide, like psychiatric risk assessment. Um, I would also just work closely with like her psychiatrist and just whatever medical team to really just determine whether or not um, her being hospitalized is really necessary. And so due to her being pregnant, I will also make sure that she receives like prenatal care and things like that. And just education, like I want her to be educated about just using alcohol while being pregnant. I will also like just assess her substance use um more thoroughly, and I would really refer her to like some type of treatment program for like people with substance use, um, that specialize really in treating women that are with child. So for discharge planning, I would just connect her with just like individual mental health counseling, some trauma focused therapy, prenatal care, case management, and things like that. I will also like just bring her support system in as well because I most definitely feel like she would need it. But I will also get her permission first to see if that's something that she would want. Um, so just my overall like just impression of this whole case is that she's just experiencing like just a huge mental health crisis, and you know, with the manic episodes and just the psychosis and things like that. And also her childhood trauma, her family abusing substances, and um, also her drinking while pregnant. And I feel like she would benefit from the psychiatric evaluation, and from being stabilized in the trauma informed treatment to address her mental health and also her substance use. So